I would like to recognize the important partnership and cooperation that we are having with the media. It's been a very productive and impactful collaboration with respect to transmitting the messaging and messages from the AU to all 55 member states with respect to what the continent is going through and what we are doing. Let me start today by, first of all, acknowledging the multiple partners that that are supporting Africa CDC in these very, very difficult times. Excuse me. The Gates Foundation has been, the Bill and Melinda Gates Foundation has been with us from the beginning. Our traditional other partners, including the Japanese government, the China government, the U.S. government, the Jack Ma Foundation, the Ethiopian Airlines, the World Food Program, USAID, the Afro Champions, Wellcome Trust, DEFIT in the UK, and the SCORE Foundation, a long list of that. The reason I go through all of this is to really show that how the international community is expressing a lot of concerns or support for the things that we are going through, and especially the forecasting that we might happen in Africa. So in terms of the situation, the epidemiological situation, as of this morning at 9 a.m. East African time, the number of global cases had reached 2.5 million cases across the world, with about 170,000 deaths. In Africa, as we speak today, 52 countries have been affected, and 25,901 cases have been reported from the 52 countries, with a resulting death of 1,242, giving a total case fatality of 5%. Let me maybe go back to the global and say that if you compare the cases between April 9 and 16, there have been a 39% increase within this period. And for the continent, we've noticed since the last time we met here an increase of 43% from last week. So that is remarkable. And there are 5 countries that are on the top on the continent with a high number of cases. That would be Egypt with 3,659 cases, representing 14% of the cases in Africa. South Africa also has very similar cases with about 3,635, Morocco with 3,446, Algeria with 2,910, and Cameroon with 1,163 cases there. If you look at these numbers on the continent and then you ask yourself the question, how do they match up with the population size per 100,000? You see that Djibouti will now be top with 98.6 cases, then Mauritius, Cape Verde, Seychelles, Morocco, Tunisia, Algeria, South Africa, and Equatorial Guinea. So this is trying to measure the number of cases by the population. The question most people are asking is that what is the fatality, the case fatality, which is defined as how many people are dying amongst those who are infected. The global case fatality rate is about 7%. And out of these case fatality rate, you see in Africa some numbers just for the discussion. Algeria's case fatality rate is 14%, so it's about twice that of the global average. Sudan 9%, Liberia 8%, Egypt 8%, the Democratic Republic of Congo 7%, and all of which have 100 cases or more. Again, the numbers are still small, and as the numbers increase, the case fatality rate will continue to be measured. Just for the record, a case fatality rate for any outbreak is usually calculated at the very end of when the outbreak or pandemic is over. That way you truly know how many people were infected, how many recovered, and how many died. So, but these are rates that we are using now to gauge and understand where we are going with this pandemic. Some activities with respect to, excuse me, this Africa CDC response. In general, we continue to receive support from several donors, as I indicated earlier. Just last week, we received 2.2 million euros from the Wellcome and the DEFI to support a COVID response. That is the continental strategy, which we have all discussed here. We are also moving forward to looking at supporting 12 member states to be able to sequence the virus and understand the genetic makeup of the virus. This will allow us to understand the chains of transmissions as the epidemic or pandemic evolves. Africa CDC just completed an equipment footprint analysis focused on the molecular testing in a number of countries to understand exactly which countries can test using the molecular tests that we do, not the regular diagnostics, but the genetic analysis there. In the area of surveillance, Africa CDC is mapping personal protective equipment manufacturers across the continent to inform and facilitate private sector investment in the manufacturing of personal protective equipment on the continent. We've also launched an infection prevention and control series of webinars and has trained over 470 experts from 67 countries on assessing infection prevention and control preparedness and triage and patient flow during just this past week. The infection prevention control community of practice with over 200 participants has been set up, and a step-down training of over 400 healthcare workers has been conducted in Nigeria. The importance of this is that we are really trying to make sure that we develop programs that will enable us to prevent, or countries to prevent, infections of healthcare workers, which is the backbone of our response. With 6 weeks webinars have been conducted on clinical case management of COVID-19 in the past 1 month, with over 4,000 clinicians trained on the platform. 326 clinicians participated in the clinical community of practice webinar in the past 1 week. In the area of research and science update, Africa CDC is mapping the research needs of member states and the current research studies being conducted across the continent for infection control prevention for COVID. Current evidence show that remdesivir is the most promising therapy for COVID treatment-19. Positive reports have been obtained from Gilead phase 3 clinical trials, and preliminary results suggest that cases responded very well to treatment, and most patients were discharged in less than 1 week. But we still have to wait for the final outcome of that results. We are also tracking registered clinical trials on the continent, and these include Egypt, about 6 different clinical trials for drugs taking place in Egypt, Nigeria, and Tunisia. In terms of guidelines, Africa CDC has just published new guidance for community use of masks this week, and I urge that and count on you all to help us move that forward in terms of publicizing it, advocating for it. We are also emphasizing that face masks can be used to reduce the spread of infection in community by minimizing the shedding of respiratory droplets from infected persons who may not even know that they are infected and before they become symptomatic. So if you read the guidance that Africa CDC issued, you see that. Africa CDC recommends community wearing of non-medical masks. I repeat, non-medical masks in settings where social distancing is not possible and where there is widespread community transmission. However, medical masks and respirators should not be reserved for use by, it should only be reserved for use by healthcare workers to ensure that we don't run out of those. And children below the age of 2 years should not be allowed to use or cover their faces using the face mask. And lastly, as we announced last week, that we launched a new initiative called Partnership to Accelerate COVID-19 Testing. We have already, since last week, rolled out 73,000 tests from our depot in Senegal. And this coming week, 500,000 tests will be coming from as part of the JACMA contribution, and that will continue to be distributed. So we are on course and meeting our target of rolling out 1 million tests in the next 4 weeks on the continent. We have 1 million tests that we've ordered already from Germany and is being shipped to our depot in Senegal, and will be arriving in Senegal, of course, this week, and they'll continue to roll that out. Our strategy is, as the tests arrive, we ship it out immediately to meet our target of 1 million in tests sent out in the next coming 4 weeks. Again, I count on the media, all of you, to help us, partner with us to make this a movement. And we are calling it, again, Partnership to Accelerate COVID Testing, with a tagline of track, test, and trace. Again, track, test, and trace. Thank you.